Following the discovery of the suspicious abandoned package on the subway, a number of the passengers present to the emergency department with abdominal cramp, vomiting, shortness of breath, and generalized weakness. Physical examination of these patients reveals excessive perspirations, bilateral wheezing, bradycardia, and meiosis. Which of the following is the most important treatment of this patient? Ecothiopate, hexamethonium, pancuronium, paralidoxime, and pyridostigmine. So pick the point. The patient, they are the passengers having abdominal cramp, vomiting, shortness of breath, generalized weakness. Physical examination shows excessive perspiration or excessive sweating, bilateral wheezing due to bronchoconstriction, bradycardia, and meiosis. So all these signs showing and giving us hint that the patient is suffering from hyperactivity of parasympathetic system, because the parasympathetic system is involved in the meiosis of eye, it is involved in the bradycardia, it is involved in the wheezing, it is involved in excessive sweating, it is involved in the abdominal cramp because it increases the contractility of the smooth muscle of the GIT, which leads to vomiting, sometimes cramp. Okay, so the patient is suffering from organophosphate poisoning. So what is organophosphate poisoning? That if you look the neurotransmitters, the acetylcholine in case of parasympathetic system, they release into the synapse. Okay, they act on the receptor, muscarinic receptor, and sometimes nicotinic receptor also. And when these acetylcholine act, now start the activity of this muscle or this affected organ. Okay, these are the neurotransmitters, acetylcholine. So there are enzymes present in the synapses to the gap, which is called as acetylcholinesterase enzyme. The function of acetylcholinesterase enzyme is that it broken down the excess amount of the acetylcholine which remain into the gap. So there are certain medications and there are certain organic compounds which act on this acetylcholinesterase enzyme and inhibit the activity. One of the compound, that is organophosphate. So whenever the patient, mostly patients or most of the people who work in farm, okay, and they work with the pesticides, they have this sort of poisoning. So organophosphate poisoning, the organophosphate compound inhibit the activity of acetylcholinesterase. So it is act as acetylcholinesterase inhibitor. When this inhibitor inhibit the activity of enzyme, the acetylcholine activity increases. When the acetylcholine activity increases, definitely the activity of the parasympathetic system enhance, so as in the patient. So the patient is suffering from organophosphate poisoning. So anti-medication, antidote for this patient, you have to choose from all of these. So ecothiopate is not, because ecothiopate itself is an acetylcholinesterase inhibitor. Okay, and hexamethonium mostly act on the nicotinic receptors, not on the muscarinic receptor. Pancuronium is a muscle relaxant we use for the relaxation of the muscle during surgery or during anesthesia. We also use this medication. Okay, it's again act on the nicotinic receptor and it is the antagonist. It is also an antagonist of the nicotinic receptor. And what about the paralidoxime? Paralidoxime is a medication which is used as the activator of the cholinesterase enzyme. So in this case there is organophosphate poisoning, the enzyme is deactivated, dephosphorylated. So we use for the reactivation of this enzyme, so we use paralidoxime. So paralidoxime is a reactivation, it causes a reactivation of the acetylcholinesterase enzyme. Okay, acetylcholinesterase enzyme. And what about the pyridostigmine? Pyridostigmine is also a medication which is used for the inhibition of the cholinesterase. So it is also as a acetylcholinesterase enzyme inhibitor. So the best option is pralidoxime.